Hello, my name is Sophia Kagan, and I'm a Doctor of Nursing practice student at Rush University. The title of my poster is Implementing a School-Based Mental Health Program for At-Risk Adolescents. This project focused on developing and implementing a structured mental health program at a tuition-free elementary school on the west side of Chicago. The intervention targeted 41 middle school students, all of whom had a history of adverse childhood experiences, or ACEs, which placed them at higher risk for anxiety and depression. These students also had experienced the COVID-19 pandemic, and they reportedly had high levels of screen time, often exceeding 4 hours daily, which are both factors strongly associated with increased anxiety and depression in adolescents. The school's mission emphasizes holistic student support, and in response to growing concerns about students' mental health, this project was launched with 3 core objectives. For the first objective, we created a standardized workflow for staff and teachers to manage concerning mental health symptoms in students. In collaboration with school leaders, we formalized existing informal practices into a clear flowchart with action steps, evidence-based red flags, symptom indicators, and included a list of local and national mental health organizations and resources. To view this workflow, you may scan the QR code in the top center of the poster. For the second phase of the project, we integrated a structured mental health curriculum into the school's existing health and wellness course. We selected COPE, which stands for Creating Opportunities for Personal Empowerment, a 7-session cognitive behavioral therapy-based program that has been shown to reduce depression and anxiety symptoms in adolescents. After completing the instructor training for COPE, the school's health teacher implemented the program with the 6th and 7th grade students. For the third objective, we delivered a mental health education session for teachers and staff. The content of this session focused on identifying early signs of anxiety and depression in this population of students, understanding key risk factors such as ACEs, and introducing the concept of benevolent childhood experiences, which are positive experiences that have shown to buffer against poor mental health outcomes associated with ACEs. A pre- and post-survey measured knowledge gained, and analysis of these results showed an average improvement of 28% in survey scores, as shown on the graph on the bottom of the poster. This project was guided by the RE-AIM framework, which helped ensure the intervention was both practical and sustainable within the real-world school environment. The key findings of this project: first of all, the mental health process workflow helps standardize how teachers and staff respond to students who may exhibit concerning symptoms, and it offered a clear guide for those who may not have a mental health or other health-related background. While the COPE curriculum had strong content, the students' engagement was limited due to its workbook-heavy format. However, the addition of hands-on components such as mindfulness, deep breathing, and guided imagery were far more effective in maintaining the students' engagement. These interactive practices encourage discussion, self-reflection, and greater connection to the material. The teacher's educational session was well received and sparked productive dialogue. In response, the school leaders contracted a behavioral health consultant to continue trauma-informed training and staff support in educating students with traumatic backgrounds. In conclusion, this project demonstrated that structured, low-cost interventions can be both feasible and impactful in underserved school settings. When adapted to match students' developmental needs, particularly through interactive and skills-based learning, mental health programs like the COPE program can promote better engagement and outcomes. Long-term success will depend on ongoing teacher education and leadership's commitment to embedding mental wellness in the school culture. Thank you to the school leaders, to the teachers and staff, my project partners, and my academic advisor for their support. Thank you all for your time.